everyone. In this session, we are going to cover an ultra important topic, that is ovarian tumors. In your university exam, very frequently you get a long question on ovarian tumors. You get a long question especially on the surface epithelial tumors, either serous carcinomas or mucinous carcinomas. So we will be discussing all these in detail. Or you can get a short note or very short note on one of the germ cell tumor, that is dysgerminoma, York sac tumor, teratoma. So we are going to discuss all ovarian tumors in detail. We are starting a very important topic, that is ovarian tumors. So this is the overview. These are the headings under which I'm going to describe this topic. So first of all, I will let you know the classification of all ovarian tumors. I will divide the ovarian tumors under 4 categories. Out of them, we will discuss the details of few. So the details of the few which are important in our syllabus and frequently asked in university exam. So I will be discussing 2 important tumors among the surface epithelial tumors. I will be discussing serous tumor and mucinous tumor in detail. So I will let you know for each of them the introduction, types, age, bilaterality, risk factors, gross, microscopy, clinical features and tumor markers. So if the question is coming on serous, so write down all these things for the serous. If the question is coming on mucinous, write down all these things for mucinous. If the question is coming on overall surface epithelial tumors of the ovary, you have to write down both in a comparative manner. You can compare them also. We will compare them in a comparative manner. After that, we will see the germ cell tumor. There are 6 germ cell tumor. I will tell you the classification, all 6, but 3 of them are ultra important, for which we will see the details. So out of 6, we will see the details of the 3. Which 3? Dysgerminoma, York sac tumor and teratoma. They are frequently asked separately as a short or very short note and rarely for the long note also. So for them also, we will make a comparative table between them. We will compare them under the following headings. Introduction for each of them, most common for each of them, age group, tumor markers, gross, microscopy and prognosis for each of them. So we will make 2 comparative tables, one among the serous surface epithelial tumor and one among the germ cell tumor. So at the end, you have to learn these 2 comparative tables. Okay, so let's start it. First of all, let me tell you the classification of ovarian tumors. To understand the classification of ovarian tumor, you have to understand the diagram of the ovary. Have a look on the diagram of the ovary. Can you see the diagram of the ovary? In the diagram of the ovary, you all can understand this lining is known as coelomic epithelial lining. This lining is known as coelomic epithelial lining. Okay, the lining of the ovaries is known as coelomic epithelial lining. Inside the ovary, there are many follicles. Every month, one follicle mature in one of the ovary. There are 2 ovaries, right and left. So every month, alternatively, one of the follicle get mature. The mature follicle is known as Graafian follicle. So here you can see this is Graafian follicle. So this is Graafian follicle, and Graafian follicle contains the germ cell. So this is the germ cell present inside the Graafian follicle. Can you see the stroma in the background? The background is known as stroma. This is the background, which is known as stroma. So how many types of tumors are present in ovary? So it depends on the origin. If the tumor is arising from the coelomic epithelia, they are known as surface epithelial tumor. They are surface epithelial tumor. They are arising from the epithelium. If the tumor is arising from the germ cell present inside the Graafian follicle, they are arising from the germ cell present in the Graafian follicle. These are known as germ cell tumors. If the tumor is arising from the background, can you see the background? If the tumor is arising from the background, these are known as stromal tumors because they are arising from the stroma. So they are known as sex cord stromal tumors. And these are the primary tumors in the ovary. And apart from that, metastatic tumors can occur in which the primary tumor is present in some other organ and secondarily via blood or lymphatics it is involving the ovary, or via transcoelomic route it is involving the ovary. So that is metastatic tumors. So there are 4 types of tumors in the ovary. What are the 4 types of tumors in the ovary? Learn the diagram. So in the ovary, this lining is known as coelomic epithelia. So tumor can arise from the coelomic epithelia. These are known as surface epithelial tumors. So inside the ovary, many follicles are there. Every month, one follicle matures, that is known as Graafian follicle. Graafian follicle contains the germ cell. So tumor arising from the germ cell are germ cell tumor. And the background is known as stroma. So tumor arising from the stroma are sex cord stromal tumors. So these are the 3 important primary tumors present in the ovary. So these are the surface epithelial tumors. These are the stromal tumors, sex cord stromal tumors. To say it correctly and completely, say it sex cord stromal tumors. And finally, the tumor arising from the germ cell is known as germ cell tumor, GCT. So these are the 3 primary. Apart from that, the metastatic tumors can occur. The secondary tumors in which the primary is present in some other organ, but the tumor is involving the ovary secondarily. These are the metastatic tumors. So these are the 4 types of tumors present in the ovary. Now let me tell you the classification under each category one by one. So let's take the first category,